Welcome to Counterpoint. I'm Tanya Granick-Allen. Since the beginning of COVID in early 2020, there has been so much upheaval in Canadian lives. Speaking from my own experience between lockdowns, contradictory and at times nonsensical health orders, masking regulations, social distancing, PPE, and the never-ending drama with vaccine passports, suffice to say that I, and so many of us, have been put through the ringer and we are exhausted. At times, it feels as though we are puppets in a game of politics with no end in sight. And this isn't to make light of the virus. It certainly is real and people have died from it. But are some politicians making decisions with COVID based on, well, politics? Many chinks have appeared in various provincial governments' armor over the course of the past 18 months. And what I mean by that is that elected MPPs or MLAs across this country have been pushed out or disciplined for simply questioning their government's path forward during COVID, questioning the data or the science, or even asking for due democratic process. Anytime I hear of a politician sticking their nose out and getting a reprimand, a demotion, or simply kicked out of caucus, my spidey sense perks up. Usually there's something else there. Well, today we're going to hear from two Ontario MPPs who were booted out from the governing caucus led by Conservative Premier Doug Ford. Later in the program, we'll hear from former Conservative, now a New Blue Party MPP, Belinda Karahalios. But now I'm pleased to welcome former Conservative, now Independent MPP, Roman Baber, to hear his perspective on what is going on and what he's doing about it. Good to have you here, Roman. So you were removed from the PC, the Progressive Conservative Ontario caucus, in January 2021. What happened?
So towards December and January, I started hearing multiple reports and I started getting dozens of phone calls from parents primarily that expressed tremendous concern for their children being in lockdown. And I started understanding a very basic proposition that the lockdown is actually causing more harm than it benefits. I felt fairly comfortable after May 2020 and advised the Premier that we see that more than 80% of the risk is in long-term care, as per Statistic Canada last week. And regretfully, more than 80% of the folks that passed away 90% of them have a comorbidity, and most of them are in their last year of life. And that is to say that we should focus on those lives and throw all of our resources in congregate settings and protect the vulnerable instead of locking down 15 million Ontarians. So towards mid-January, I apologize, I wrote a letter to the Premier suggesting that the toll on Ontarians' health and mental health is such that the current policy is not sustainable. And I offered to focus on long-term care, build capacity, and fix the narrative and end the lockdown. And as a result, I was ousted out of the Ontario PC caucus.
So you're ousted for questioning the path forward that the government was, I guess, determined to be on, and you had, maybe we should consider these stats and this options instead. I have to say that you put out some excellent information over Twitter. I really enjoy reading your tweets. You always have excellent statistical research. And that's what I like to look at, black and white numbers, because the numbers don't lie. So how do you think the Ontario government, is a very silly question, I suppose, but how do you think the Ontario government has done with handling the COVID situation? Where have they done well? Where should they be doing better? You're part of that government.
Well, regretfully, we're now seeing that the premise behind my argument, that is the lockdown does a lot more harm than it benefits, has proven to be correct. We now know that the increase in overdose, the increase itself under age 65 in mortality caused by overdose is 3 times greater than all mortality caused by COVID. We know that we had 250,000 surgeries postponed. We had 1 million cancer screenings missed from March 2020 to March 2021, according to QP briefing. And so we are now understanding that the toll of COVID response by way of human lives is actually much greater than the regretful toll of COVID, which is, again, a very serious infection, but perhaps requires a different approach. And now we're seeing a remarkable erosion of very, very basic democratic principles, such as we should not be forced to do anything against our will. And I'm open with your viewers and everyone who asks. I'm pro-vaccine, but I'm also pro-choice. And to force folks to choose between the ability to put food on the table and their personal healthcare choices, in my view, inhumane and inappropriate and very regretful.
Yes, we've seen so many stories come out in the last several weeks as we know that these deadlines within healthcare settings especially are coming forward where employees have to either get the jab or get out essentially. These exemptions that have been offered seem to really hold no water. Well, I want to pick up this discussion in just a few minutes when we return from this short commercial break. Stick around. Welcome back. We're discussing the Ontario Conservative government's path forward during COVID, and we're joined by former Conservative MPP, now Independent MPP, Roman Baber, MPP for York Centre. Roman, before commercial break, you were discussing some of the concerns you had with the government's response in COVID. Your voicing of those concerns landed you out of caucus as an Independent MPP. Probably when you took your oath of office, you never thought that that would happen. I always like to take a step back and say, well, obviously there were consequences to you opening up and speaking out about these things and raising concerns. Why did you do it? Why stick your neck out like that? Most MPPs are just happy to go with the flow. Why do it?
Tanya, I've been very blessed in my pre-politics career. Many know that I'm an immigrant to Canada, and I've had every opportunity to succeed, to study, to start a small business, and thankfully, I've been very, very blessed. I came into government to try and bring some of my private sector experience to government. And I didn't perceive myself as serving a premier or serving a party. I serve the constituents of York Centre and I serve all Ontarians. And I felt when parents were calling me multiple times a day, telling me about their child being depressed and suicidal and hearing of overdoses every other day and surgeries being canceled, that I wasn't going to have any part of it anymore, especially because in mid-January, I made the assessment that Doug Ford was not going to fold. He was going to quadruple down, triple down, and regretfully, I was right. Also, I think that as public servants, we have a duty to call out injustice and wrong where it exists, and nowhere does it exist more than right now, not only as it comes to the job mandates, but also as it comes to basically forcing folks to do something against their will. And that goes to the children as well, where the risk-benefit analysis is not even close, but we're precluding children from leading normal lives by preventing them from playing hockey or going to the movies or making them social pariahs in school. We are in a very difficult framework that requires some very difficult thought and conversation.
And, as a trained lawyer, you're a trained lawyer and that was your profession just before you jumped into being a politician as an MPP. Obviously there's some legal consequences when governments take certain actions or inactions. So I assume also with your legal background that might have also helped it with the impetus. We talked about jobs. You recently attempted to table something called the Jobs and Jabs bill. I think that was a term you gave it. Can you explain to us what this bill was about and what happened to it?
Yeah, the bill basically sought to prevent any Ontario employer from terminating or suspending an employee because of their vaccination status or for failing to disclose their vaccination status. Now, unlike Bill 12, where the Liberal Party, the Liberal House leader, tried to bring a mandate in healthcare and education, and of course the Conservatives were going to vote it down. They will never let a Liberal bill pass. That bill sought to mandate vaccination potentially without leaving any recourse. But what we see happening now is the government doesn't in fact mandate vaccination. Not in healthcare, not in education. It prescribes education and testing. Mm-hmm. What happens is private employers and government institutions, and primarily in the first responders and education and healthcare fields, are passing their own mandates. And so the only way to stop this is actually to create a prohibition, such as the Jobs and Jabs Act, that would prohibit employers from reprising or terminating employees because of their vaccination status. Unfortunately, the bill passed first reading, but it was blocked as I try to move it to second and third reading. And it's very, very regretful because we're effectively sentencing. The Ontario government is sentencing hundreds of thousands of Ontarians to unemployment. Just an hour ago, Minister of Education Stephen Ledger said that approximately 50,000 education employees are not vaccinated and may be facing termination. And education. So we have to have a sober second thought as to what is really transpiring here. And I would encourage the Ford government to finally put this ideological attempt at vaccinating everyone away. We know that vaccine doesn't prevent transmission. So the argument that we're putting other lives to someone who's unvaccinated is putting someone's lives at risk, in my view, is very perverse, false, and is very dangerous because it demonizes an identifiable group of people and actually protect these families, protect these jobs.
Just really quickly, who blocked your bill? You said it was blocked. By whom?
So, we were very attentive, trying to understand. We subsequently saw some video seeing that the NDP has also blocked the bill. But we made it out very clearly that House Leader Paul Calandra, the Conservative House Leader, yelled no, thereby withholding unanimous consent and making sure that the bill doesn't pass.
Okay, we have 20 seconds. What is your hope that you hope to see in the next 6 months?
A return to sanity, a return to some basic principles. I think the very big prerequisite is that the level of fear of the virus subsides. And that is only made possible through fair narrative by public health and government and our healthcare professionals.
We'll be right back. Welcome back. And now we're joined by MPP for Cambridge, Belinda Karahalios, who is a former Progressive Conservative MPP and now is the New Blue Party MPP. Welcome, Belinda. Thank you so much for joining me today.
Thank you so much for having me, Tanya. Thank you.
Excellent. So obviously, when you started your political career, you probably didn't anticipate that one time when you ran as a Progressive Conservative MPP that you would be then basically booted out from your party and now sitting as the head of another party. What happened? And of course it had to do with COVID, but tell our viewers what happened and what caused you to stand up.
So it was, it wasn't just COVID. So, the lack of conservatism in the PC party had been going on for a while now. I've said before that, they've been spending more than the Liberals even before COVID. So back in July, I was still the parliamentary assistant to the Solicitor General. She had tabled Bill 195, the Reopening Ontario Act. And this bill allowed the government to end the state of emergency, but maintain all of its emergency powers, but without any vote or debate from any members in the Ontario legislature. I was very clear about that this was wrong, that it was unnecessary. I voted against the bill and was quickly kicked out of the PC caucus, as you mentioned, as well as 18 of our volunteers on the Cambridge Riding Association.
Wow. And so this is July 2020 for our viewers' context. So this is after the first set of lockdowns, yes. When, Ontario, again, 1 in 3 Canadians live in this province. It's a huge economic engine. We're trying to open things up, get the economy going again. And I remember this very clearly, and we were all very shocked. Now, were local constituents concerned about Bill 195, or was this you going off doing your own thing?
There was a lot of concern. So there are people that do pay attention to what goes on in the legislature. And I had been speaking out about it as well. But we received a lot of feedback from people saying, you can't vote for this bill. I had seen how bad this could be. You look at the bill and you realize what kind of unlimited power there is. And that's not good for any government to have. And so, yes, I was the only current or former PC MPP to actually vote against the Reopening Ontario Act.
Obviously, a lot has happened since then. We've been in second, third, I don't know, are we in a fourth lockdown? Who even knows anymore? And there have been so many things happening since then. What has, since that time, since July 2020, what has caused you more concern since then?
So it's the complete chaos that's happening under Doug Ford and his PC government. They've mandated masks on children for as young as 2 years of age. They've introduced this vaccine passport. Their goalposts are always moving, and nobody can trust what's coming out of his mouth when he's going up there and doing his announcements every day or every other day now it is. And it's hard on the people of Ontario because, there's no control over what he's going to say or do. They, like you said, they've locked us down 3 times. Those in the personal care industry and food and service, they were hit the hardest because they were the ones that didn't get to see reopening until much later. And now they're tying access to these establishments with access to your personal health information. And at the end of the day, whether or not you choose to get vaccinated is nobody's business.
Right. And, obviously we've had other shows where, lawyers have been concerned with privacy concerns, human rights concerns. We've seen the Ontario Human Rights Commission come out and say that, for example, CREED exemptions really won't work any longer. And the medical exemptions are so narrow. I don't know many Ontarians who who really could qualify for something as such. Therefore, it makes me wonder, why the coercion and tying it to jobs? And, we were speaking to MPP Roman Baber and hearing about his jobs and jobs bill. I do have concerns about the future of Ontario when people are feeling coerced. That's what's happening.
Yeah, that is exactly what's happening. And, there are individuals who are, they don't want to get the vaccine, whether it's for medical reasons, whether it's a personal choice reason, it doesn't matter. You should have that choice. You should be able to choose whether or not you wear a mask or choose whether or not you take the vaccine. Everyone has their reasons for doing or not doing something. And this government is not respecting that choice. And, we saw with Bill 12, for example, that was tabled last week and debated last week, where they talk about, or it was a Liberal member, John Fraser, he tabled it. And it was about mandating vaccines for anyone in the healthcare and education sectors, but across the province. Mm-hmm. And we did a call to action, me and the New Blue Party. And because of your viewers and because of people across Ontario making their voices known, the PCs voted against Bill 12. But when you read the Hansard transcript about what they say, and even on Monday of this week, when Effie Trantafilopoulos talks about the NDP motion, which asks for the same thing, they admit that they're in favor. And in fact, they're encouraging hospitals and school boards to implement these vaccine mandates.
Welcome back. We're wrapping up our conversation of what's happening in the Ontario government led by Doug Ford and why some MPPs have stood up and been punished basically for doing such. And joining me is one of those MPPs, which is Belinda Karahalios, MPP for Cambridge. Belinda, before we went to commercial break, you were highlighting some of your concerns with Bill 12, which sought to mandate vaccinations for all workers of education and healthcare in Ontario. And I remember seeing that. And I was quite shocked. And it kind of came out of nowhere. But anyways, continue your thought, because I know you were trying to explain what some of the political maneuvering was happening behind the scenes.
Yeah, so we did a call to action. And again, like I said, thanks to your viewers and many Ontarians, they reached out, called and emailed all the MPPs. And the PC MPPs, even though in the debate they talk about encouraging these institutions to make their own vaccine mandates, they voted no. So now they're on the record, not once, but twice, voting no to a provincial-wide vaccine mandate for healthcare and education workers. So that was a big win. But, as we know with Doug Ford, there's always something else brewing beneath the surface. And we're going to wait to see what happens next week. But, I would encourage individuals to continue to reach out and continue to let the powers that be know that this is unacceptable.
Okay, but that bill was a Liberal MPP-driven bill. So that was a private member's bill from the Liberals. So correct. Why was it shocking that the Conservatives voted against it? Isn't that kind of what happens if the Liberals introduce something, the Conservatives vote against it and vice versa?
Not necessarily. They likely would have let it go on a voice vote, which means there's no recorded vote. They would have said aye and it would have gone straight to committee. And again, just looking at their official transcript, what they said, they are not against having a provincial mandate. In fact, they're encouraging institutions to implement their own.
They just don't want to be on the hook on it for it?
It certainly sounds like it, doesn't it? Kind of pass the buck mentality.
Okay, well, that's very disturbing. So with this information, maybe I'm a pessimist, but I feel like this is just too much politics. Can we ever navigate our way out of COVID knowing there's so much politics at play? And, as a citizen here in Ontario, I'm wondering, is there the end? I agree, the goalposts keep moving. Rightfully, wrongfully, it doesn't seem like it's right. You tell me.
I think we need to keep the pressure up. Right now, everyone's singing the same song, and I'm trying, and the New Blue Party is trying to bring balance to the debate, to bring facts. And we know the next provincial election is coming up, June 2nd, 2022. It's no coincidence that after Bill 12 was defeated and a lot of attention was brought to that bill, that the following day, Premier Ford announces, how we're getting out of step 3 and next steps. So, the pressure works. And that's why I'm saying we need to keep up the pressure to ensure that we can get back to normal as soon as possible.
Okay, so with this getting out of COVID or our exit strategy from the Ford government, there were a lot of things that were promised at that press conference. And I remember hearing most of the restrictions and I guess edicts, if you want to call them, would be lifted, including like the masking mandate. Gosh, who would have even think that would ever be lifted in time? But by March 2022, should we count on that?
If time has told us anything, it's that everything that the government has told us so far, it gets changed very quickly. And that's why I'm telling people to continue up with the pressure, because, little changes are happening. Unfortunately, once they announced the restrictions being lifted a little bit in terms of capacity limits for those businesses who are implementing that vaccine passport, then they added a little thing saying, hey, if you're a business or industry that doesn't or are not required to implement a mandate, if you choose to, then you can lift your capacity limits too. And what I'm thinking about specifically is churches, unfortunately.
We only have 30 seconds left, but do we feel that churches will have huge restrictions coming forward?
I don't think restrictions coming forward, but now they're giving those churches the power to implement their own vaccine passport in order to have full capacity. And I hope we don't see that.
Wow, yes. I mean, especially after the last year where we've seen so many pastors either fined or jailed. I can't imagine. Anyways, it will be a very tough choice for some churches, I suppose, in Ontario. Anyhow, Belinda, Karahalios, thank you so much for joining me today.
Thank you. It's so good to see you again.
I do appreciate the courage it takes for politicians and MPPs, MLAs, MPs, when they stand up to speak out against something, go against the grain of their own party, knowing that they're going to be disciplined and sometimes quite severely, as these two were booted out of their caucus for their own party, which they had campaigned for so many years. Will this have an impact going forward on the COVID restrictions? Will they be lifted, at least here in Ontario, in March? We don't know, but we'll keep our eye on this in the coming months. For Counterpoint, I'm Tanya Granick-Allen.